Bob Crawford, the Group Director of Cardiopulmonary Services at Hannibal Regional Hospital. Bob, good morning.
Good morning.
And Bob, once again in studio with us to talk about an upcoming event. Hannibal Regional Healthcare Systems and the Hannibal Clinic have teamed up for a heart health fair. Talk about first of all the whens and the wheres for that.
Well, it's going to be Friday, February the 27th, and it's going to run from 8 a.m. to noon. And it'll be out at the Hannibal Regional Hospital Mall, which is the area right at the main entrance of the hospital.
From the very first day I set foot in that mall area, I'm thinking this does not look like it should be the lobby of a hospital. This looks like it should be out in a truly, I mean, you call it a mall, and that's what it looks like. It looks like someplace you go to shop or whatever.
Yeah, I think the intent of design back in 92, 93 was that it made it a little easier for outpatients to find where they needed to go to register for testing, and kind of like spokes of a wheel off the mall.
Yes, that's right. That's right. And anybody who's been there, as we say, know what we're talking about. So as you say, this coming up on February the 27th, this Heart Health Fair. So talk about what's going to be happening.
Well, this is similar to the one we offered about a year ago, back in February. And we're going to have screenings available for people, but they're going to need to call and reserve their spot because some of the things that are in this screening require them to be fasting. So if they'd like to give us a call, we'll get them scheduled. They can have blood testing, just a finger stick, for things like total cholesterol and the TC-HDL ratio, their triglyceride level, their fasting blood glucose, which is a measure of their blood sugar. We'll be taking their blood pressure, height, weight, calculating their body mass index, which is an indication of how near one is to their predicted normal weight, whether underweight or overweight. We'll be doing something called a ankle brachial index, an ABI, which is a screening for circulation problems in the legs. And they're also going to have an ultrasound stroke risk screening available, which will give us an idea of screening as to risk for stroke.
Mm-hmm. And of course, as you say, all of this revolving around things cardiopulmonary, things having to do with the heart, the blood, the circulatory system.
Absolutely correct. We have to think of it as a whole system, not just the heart, but the blood vessels, the blood, the lungs, the metabolism of the body, and everything all working together.
Yeah, that's one of the things that I have learned in having folks like you in, that's why they call it cardiopulmonary. Cardio is heart, pulmonary is circulation, and it's all if one doesn't work, then you're in a bad way, no matter which one we're talking about.
Yeah, just like the weakest link in a chain. If it pops, we got problems.
That's right. Now you mentioned the blood testing. Having been through that a time or two or three. To me, it's amazing how many different things. Just the sample that they take, the small blood sample, comparatively small blood sample, all that they can learn from just that sample, that blood work that they do.
It is pretty amazing, and technology has developed to the point now that you can easily do a lot of these tests just with a finger stick, which is just a matter of a prick on the finger and a few drops of blood, and it's just quite a bit less involved than the old stick with the vein and the large tubes of blood, which you still have to do for certain testing. But much of this screening we can just do with that finger stick.
Yeah, it is. Well, you were talking about, you ran through the list of things that folks can get done with that when it comes to the cholesterols and the triglycerides and blood glucose. And I know they are able to check. In my case, the blood work I've had done, they're able to check for things like diabetes and PSAs and things of that nature.
Yeah, that fasting blood sugar is a good screening for people that might be diabetic or pre-diabetic. So it's very worthwhile screening.
Mm-hmm. Having to be at work early in the morning. Most folks, when they go do that in the doctor's office, they do it first thing in the morning. So as long as they just, they don't have to worry about, skipping a meal along the way. But since I'm at work so early in the morning, and I usually get those go to the doctor in the afternoon, and I wind up having to I get to eat breakfast, but that's about it till I get to the doctor in the afternoon. But whatever your schedule permits.
Yeah, they want to make sure that you're fasting an adequate time for doing the blood work, and that's why we're asking people to call in so that we can put them on a schedule, and they can kind of gauge when they can eat and when they can't, off of that schedule. That
So a rule of thumb as far as the amount of time you should have fasted before you get that done is what?
Well, lots of times we'll tell people to fast after midnight when we're thinking of a morning test. But, if you can get that 6 hours or so in there, that's still pretty good.
There you go.
The longer, the better, really.
Yeah, that's right. And of course, as we say, the other things that you had mentioned, and along with the screenings, there's going to be a lot of other information that'll be there at the Heart Health Fair.
Yeah, there'll be booths set up around in the mall, and many different people will be there to explain different areas of heart health or just health in general. And we'll have things even like drawing for prizes for people to register, and there'll be some nice little prizes given away, and there'll be some healthy cooking demonstrations, possibly even some demonstrations with some snacks to try for some healthy recipes to use at home.
There you go. Well, if you've just had your blood work done, the finger stick or whatever, and you're hungry by that point, then there you go.
Yeah, we'll be sure to give you a box of juice at least. And,
there you go. Yeah, the obligatory juice box, if nothing else. But there'll be, as you say, there'll be some good things on hand. And as you say, this is something you folks did about a year ago at this time, and I'm assuming, well, obviously it was successful enough to where you're doing it at least a second time this time around.
Yeah, it was well accepted. We have some of our cardiologists that will be there on that morning, and they'll be there to answer questions for patients that might have questions about their screening results or just other questions about their heart health. So we're really looking forward to it, and we think we're really going to be able to help serve the community by having some screenings out there. Last year, we did have a few screenings that brought some issues to the participants' attention.
And that's what this is all about. For hopefully for most of the folks, it's just a kind of a way to just kind of confirm that everything's okay. But as you say, in those cases where there may be something that need to be addressed, this is could be an all important trip that the folks would take there to the hospital on the 27th.
Yep, and it's all free. So we hope people will give us a call and register and take advantage of it.
But that is the thing to remember for these screenings, that they do need to call ahead of time.
Yes.
Mm-hmm. So go ahead and talk about the screenings, the specific screenings, and that for which the people need to call ahead of time, and how they can do that.
Well, we're going to offer all those screenings to people when they're there. They will have a scheduled time, and if there's part of one of those that maybe they don't want to participate in, that's fine. But we will have them set up to just rotate through all those screenings when they do come. And hopefully that'll save them some time and give them some time to go out into the mall and visit some of the booths. And we would like them to call us. Of course, it's area code 573. And the number is 406-1639. That's 406-1639.
And that is the number if they want to get in on those screenings. And otherwise, one more time, let's cover the specifics, the when and the where for the Heart Health Fair.
It's going to be Friday, February the 27th from 8 until noon at Hannibal Regional Hospital. And even if they don't register for the screenings, they're welcome to come, take a look in the mall, talk to the people in the booths, pick up health information. We'd be glad to see them.
And is there a place online the folks can go to get information about the health fair?
Well, there's always a website. It's the Hannibal Regional Hospital website. And they can look there, and we do have information on there along with information of other things that the hospital is offering.
All of the good things that are going on in the life of Hannibal Regional Healthcare Systems. Bob Crawford, we appreciate the visit.
It's been my pleasure. Thank you.